A very good evening to all of you. Today we are going to do the MCQ challenge for surgery. See, remember, surgery is a very important branch as far as Neet PG is concerned. And if you score well in surgery, at least 30 questions belong to the chunk of surgery. So 120 marks. So let's begin with the first question. Most common cause of small intestinal obstruction is A. Intussusception, B. Idiopathic adhesion tumors, idiopathic adhesions, C. Tumors, D. Postoperative adhesions. Well, the correct answer here is postoperative adhesions. The most common cause of small bowel obstruction is post-surgical adhesions. Most common cause of intestinal obstruction in adults are intestinal adhesions, that is bands of fibrous tissue in abdominal cavity that can form after abdominal or pelvic surgery. In children, the most common cause of intestinal obstruction is telescoping of the intestine. So the correct answer here is postoperative adhesions. Cox specular tumor is A. basal cell carcinoma, B. squamous cell carcinoma, C. ulcerated sebaceous cyst, D. cylindroma. It is ulcerated sebaceous cyst. Cox specular tumor is a sebaceous cyst, a linked growth that can resemble a squamous cell carcinoma, but it is not a squamous cell carcinoma. The proliferating cyst is usually solitary, but it often arises from a simple tricholemous cyst in the hair follicle epithelium. False about gastric lymphoma is A. Stomach is the most common site. B. Associated with H. pylori infection. C. Total gastrectomy with adjuvant chemotherapy is treatment of choice. 5-year survival rate after treatment is 60%. Now, the false statement is total gastrectomy with adjuvant chemotherapy is the treatment of choice is the false statement. In fact, stomach is the most common extranodal site of lymphoma. It is of two types, primary and secondary. Primary gastric lymphoma is lymphoma of stomach which exhibits no evidence of liver, spleen, mediastinal lymph node, or bone marrow involvement at the time of diagnosis. So the correct answer is C. Please click the link in the description box to join the 2-day Ultimate Neet PG Breakthrough Blueprint Masterclass. It is a perfect masterclass. It will take you to the next level of preparation and it will speed up your revision procedure and it will boost your confidence to a next level because most of us are facing the problem of revision and what to study, what not to study. The thing is that what not to study is more important than what to study. And once you chunk up what to study, you have to repeat it again and again. That is the key to success. Which one of the following preservative is used while packing catgut suture? A. Isopropyl alcohol, B. Colloidal iodine, C. Glyceraldehyde, D. Hydrogen peroxide. This is isopropyl alcohol. This isopropyl alcohol is a routine packing fluid used in packing catgut suture. Catgut is available in glass tubes containing isopropyl alcohol and small quantity of water. Catgut is prepared from the intestine of sheep. So the correct answer here is A. Isopropyl alcohol. Primary hyperparathyroidism, pheochromocytoma, may be associated with which type of thyroid cancer? A. Medullary carcinoma of thyroid, B. Papillary carcinoma of thyroid, C. Anaplastic carcinoma of thyroid, D. Follicular carcinoma of thyroid. See, this primary hyperparathyroidism, pheochromocytoma, it can be associated with medullary carcinoma of thyroid. So it is characterized clinically by medullary thyroid cancer, MTC, pheochromocytoma, hyperparathyroidism. Approximately 70 to 95% of individuals with MEN2A develop medullary thyroid cancer, 50% develop pheochromocytoma, and 15 to 30% develop hyperparathyroidism. So the correct answer here is A, medullary carcinoma of thyroid. Meconium milas is associated with cystic fibrosis. Which of the following nerve is commonly damaged during McBurney's incision? A. Subcostal nerve, B. 10th thoracic nerve, C. 11th thoracic nerve, D. Iliohypogastric nerve. This iliohypogastric nerve which is damaged. Dysphagia lassoria is due to A. Esophageal diverticulum. B. Aneurysm of aorta. C. Esophageal web. D. Compression by aberrant blood vessel. It is compression by aberrant blood. Surgery for undescended testes is recommended at what age? A. 6 months. B. 12 months. C. 24 months. D. 36 months. It is 6 months. Optimum age for surgery in case of undescended testis is 6 months. The surgical procedure done is orchidopexy. Earlier intervention should be considered in order to theoretically prevent the complication of cryptorchidism that may be manifested before 1 year of age. Please click the link in the description box to join the 2-day Neet PG Breakthrough Blueprint Masterclass. This dacron vascular graft is a textile biologic, textile synthetic, non-textile biologic, non-textile synthetic. It is textile synthetic. This dacron graft is a type of textile synthetic graft. It is associated with increased risk of thrombosis due to low flow rates. They are pre-coated with collagen, which eliminates the need for pre-clotting. It is now reserved for aortic and high-pressure large diameter bypass graft used as aortic endografts. So the correct answer is textile synthetic. What is the most common position of appendix? A. Pelvic. B. Paracolic. C. Retrocecal. D. Retroperitoneal. It is retrocecal. Double bubble sign is seen in A. Duodenal atresia, duodenal stenosis, volvulus. D. All. It is all. Culling ulcer is seen in A. Burns patient. B. Patient with head injury. C. Jollinger-Elser syndrome. D. Analgesic abuse. It is Burns patient. Culling ulcer, a stress ulcer associated with burns and most commonly found in first part of duodenum. Culling ulcer is an acute gastric erosion resulting as a complication from severe burns when reduced plasma level leads to ischemia and cell necrosis. The condition was first described in 1823, named after Thomas Blizzard Curling, who observed 10 such patients in 1842. All are true about amoebic liver abscess. A. More common in females. B. More common left lobe of liver. C. Metronidazole main step treatment. D. A and B. It is D. A and B. C. Male preponderance is of greater than 10:1 has been reported in all studies. The right lobe of liver is more commonly affected. So both the A and B statements are not correct. Indication of liver transplantation are all A. Biliary atresia, sclerosing cholangitis, hepatitis A, cirrhosis, except hepatitis A. C. In hepatitis A, liver transplantation is not required. Liver transplantation indication for those children and adults who, in the absence of contraindications, suffer from severe irreversible liver disease for which alternative medical surgery have been exhausted or available. Care sign seen in splenic rupture is A. Pain over left shoulder, B. Pain over right scapula, C. Periumbilical pain, pain over renal angle. It is pain over left shoulder. See, pain over left shoulder in splenic rupture. The pain may be referred to the tip of left shoulder. This is known as Kehr sign. It occurs due to irritation of undersurface of diaphragm with blood, and pain is referred to shoulder through affected fibers of phrenic nerve. Kehr sign can be elicited by bimanual compression of the upper quadrant. Breast conservation surgery not indicated in A. Large pendular breast, B. SLE, C. Diffuse microcalcification, D. All. It is all. Mondos disease is thrombophlebitis of superficial veins of breast, B. Carcinoma of breast, C. Premalignant condition of breast, D. Filariasis. It is thrombophlebitis of superficial veins of breast. Lateral aberrant thyroid refers to congenital thyroid abnormality, metastatic focus in lymph node, struma ovary lingual thyroid. Lateral aberrant thyroid refers to a metastatic focus in lymph node. So correct answer here is D. Most common site of CA esophagus is A middle one third, B upper one third, C lower one third, D lower end of esophagus. It is middle one third. Corkscrew esophagus is seen in which of the following condition? A. Carcinoma esophagus, B. Scleroderma, C. Achalasia cardiac, D. Diffuse esophageal spasm. It is seen in diffuse esophageal spasm. The most common cause of type of tracheoesophageal fistula is A. Esophageal atresia without tracheoesophageal fistula, esophageal atresia with proximal tracheoesophageal fistula, esophageal atresia with distal uh, tracheoesophageal fistula, D. Esophageal atresia with proximal and distal fistula. It is C. The best investigative modality for gallstone is A. Oral cholecystogram, B. Percutaneous transhepatic, C. Ultrasound, D. Intravenous. It is C. Ultrasound. Strawberry gallbladder is seen in A. Gangrene of gallbladder, B. Porcelain gallbladder, C. Adenomatosis, D. cholestasis. B. Apomine is associated with the syndrome, A. Jollinger-Ellison syndrome, B. Werner-Morrison syndrome, C. carcinoid syndrome, D. Cushing syndrome. This is Werner-Morrison syndrome. All are resected in Whipple's operation, A. duodenum, head of pancreas, neck of pancreas, common bile duct, except neck of pancreas. The tendency of colonic carcinoma to metastasize is best assessed by A. Size of tumor, carcinomembran, depth of penetration of ball, depth of penetration of ball. Commonest cause of interception is A. Submucous lipoma, Mecus diverticulum, hypertrophy of submucous pair patch, D. polyp. It is hypertrophy of submucous pair patch.